We all know that the price of prescription medication has gotten completely out of hand, and thus far, from the Biden administration, they did a couple of little changes that'll reduce the cost of a few drugs over time, but we need something bigger than that. We need new ideas. And one man has an idea. It's part of a growing trend that I find pretty interesting, actually. His name is Nate Hucks, pharmacist in Ohio, who owns a traditional pharmacy. But in addition to that traditional pharmacy, he decided to open up a different one. This is Freedom Pharmacy that's been operating for 2 years. It's got a different model. It's a pharmacy that takes no insurance. It only sells generic medications at wholesale prices plus a small markup that goes to the pharmacy. There are others like this. They're sometimes referred to as cash or self-pay pharmacies, and sometimes they can save you a significant amount of money on non-generic or what are normally non-generic medications. So he says one of the reasons they wanted to do this wasn't just to save money, although that's a big part. It's that, and I did not know this, when you operate a traditional pharmacy, because you're dealing with insurance, there are all these additional rules and regulations and paperwork and fees and all that stuff that you have to pay. So that's additional overhead that's not necessary in any strict way. So let's give you an example of how it actually works. Sharon Kitchen is a retired registered nurse, has arthritis and fibromyalgia. At Freedom Pharmacy, her 8 medications were far cheaper. One, $141 for a 3-month supply with insurance. That's with insurance. $23.40 without it. So despite the subsidy, the non-generic version is still 6 times higher. I'm not good at math. And so imagine over the course of years for people who have multiple medications, how much money you can theoretically save. Now, this doesn't work in all cases. There are not generic versions of every medication, unfortunately. That's tied in with the overall larger problem of why medication is so expensive, because they are helped out in so many different ways by the politicians they bought. And he even admits that this is not a solution for everyone, but he thinks since he owns both and he can look at the cost between the two, he can compare how people would do under both models. He says for at least a quarter of his patients, they will save a good bit of money by going this route. And I had just never heard about this before. I guess I was waiting maybe for John Oliver to mention it or something. But anyway, I thought it's an interesting model. I could see this potentially working.
Yeah, I mean, anything that is heading towards solution to help alleviate the pain of the people, literal and figurative pain of the people in this country, I think is something worth paying attention to, because there are some people out there who are just thinking about making more money, and they don't care how many lives are lost in the process. So I'm sure that there is a better way to make this better, or there has to be a way to make it better, but at least it's on the way, right? As opposed to, my mom had a medication that was $500 for 30 pills. And one of the doctors said, I have to change the dosage. And it went down like $350 because they changed the dosage because another company makes the medication in a different dosage. And she just takes a pill and a half. But that's a $350 difference.
Wow.
On a medication that she absolutely needs to survive. And so when I think about just the average person doesn't know those loopholes, and some people aren't willing to tell you that because they profit from that. We just happen to have a doctor that has empathy, but I think about the people who are out here trying to do stuff. That's what I'm about. What are you doing to make it a better place? How are we making the world better? That's what I'm about. I don't want to hear about your constant grievances. We all know it's messed up. We can turn to the right, to the left, and we already know it's gonna be right there. But what we need to do is focus on solution. And I'm sure that's helping a lot of people, especially in Ohio, because there's a lot of struggle in Ohio that we don't really focus on.
Yeah,
we like to talk
you're totally right.
In New York,
Yeah. I don't know. Like this has got to be a part of other problems. Like the biggest issue, of course, is that the pharma companies have bought politicians, and the politicians give them all sorts of legal protections that allow them to massively overinflate their price and eliminate as much competition as possible. And those same politicians will then tell you about how much respect they have for the free market. Nothing about it is free. It's all crafted. It's an investment by the pharma companies that pays off massively. This might be one thing that can help.
For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/The Damage Report. And you can ring the bell wherever it is so you don't miss anything.